Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be going over part 2 of anger and aggression, and I'm going to be covering de-escalation techniques as well as medical management, pharmacological management, okay? So before we get started, as always, I'm going to ask you to please support me, help support this channel by liking this video. You're going to love it. Press that like button now so you don't forget, please. Subscribe to my channel if you haven't done so already. Maybe you can share one of my videos on your social media platform or share it with a colleague, a classmate, even a nursing instructor. And don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. If you haven't watched part 1, I encourage you to go back and watch part 1 because this part 2 will make more sense. But if you can't watch part 2, then go back and watch part 1. But the point is, it's best that you watch all parts of the series so you can have a very good understanding of violence, anger, aggression, how to spot it before violence happens, nursing interventions, and medical management. All right, guys, so let's get started. Take a look at this box right here where it says de-escalation techniques. I'm not going to go over all of them. You read them on your own. Press pause, read them on your own. But I'm going to go over the ones that you're most likely to see on your nursing exams. But remember, guys, I don't write your tests, so make sure you know all of them. All right, let's talk about some techniques. Maintain calmness. Calmness not only for yourself, but your patient. You want to try to de-escalate and keep them as calm as possible. And that includes decreasing sensory stimuli. Identify stressors and stress indicators, and help your patient to identify stressors so they can start to recognize when their anxiety or their irritation starts to creep up. Because if they can identify that before they get to that part where they're actually violent, they can start using self-calming techniques to kind of de-escalate themselves, okay? So you want to teach that to the patient, but you also want to start to understand what causes them to be stressed, what causes them to start having increased anxiety. So once you start seeing that pattern, you start understanding that pattern, you can intervene much more quickly. Use a calm, clear tone of voice. Remember, we're trying to decrease stimuli, so you can't speak fast. And remember, guys, as the patient gets more angry, they get more aggressive, their ability to think, their ability to process thoughts, it decreases. Okay, so you want to use calm tone and speak in a normal pace or even a little bit slower, but not quickly. Look at this. Avoid invading personal space. In times of high anxiety, personal space increases. And as I said in part 1, what you want to do, guys, whatever the length that patient needs of their arm or their leg to be able to punch you or hit you or assault you or kick you, you need to stand that distance plus 1 feet, because that buys you time and it buys you space. Avoid arguing. Do not enter into power struggles with the patient. All you're going to do is make the situation worse. Give several clear options, and usually you want to give 2, 3 tops, right? So if the patient's being aggressive, what they're not going to do is hit you and the other clients, but you can give them 2 choices. Would you like to go to your room, or would you like to go to the quiet room? Or if you're giving a 3rd choice, would you like to go take a walk with me in the garden? That way, you're giving them choices so they feel like they still have, control, but at the same time, you're keeping the patient safe, you're keeping yourself safe, you're keeping the other patients on the unit safe. Be assertive, but not aggressive. Aggressiveness, guys, only makes the situation worse, and it only escalates the problem. Do not take chances, maintain personal safety. And on the side, you'll see I put a star next to this. I wrote, what did I write? I wrote, no exit, not back to patient. So know your exits. Make sure there's a clear path to the exit, and don't ever, ever, ever turn your back to the patient, okay? Make sure you know these techniques. Pause to read. Now let's go over some medications you need to know about. Excuse me. Drugs Drugs used for acute management of violent behavior. First, we're going to start with the benzos. Lorazepam, a very important drug to know. Look what it says, drug of choice. So when it comes to management of aggressive behavior, our go-to drug class that we're going to use is what? The benzodiazepine, specifically lorazepam. Okay, that is a drug of choice. Some important things to know. We're going to use caution with patient who has liver dysfunction, right? So you're going to be looking at the liver function test, the AST, the ALT. You're going to be paying attention to that. Our alprazolam, that's the Xanax. Paradoxical, whenever you see that word paradoxical, that kind of means like ironic, because you're getting an opposite effect of what you would expect. So with Xanax, a paradoxical or opposite response with personality disorders and elderly. So even though we're giving this medication to kind of control the violent behavior in patients who have personality disorders or the geriatric population, we may see the opposite response, and we may see them be even more aggressive. So that's very important for you guys to know. Let's look at the first generation antipsychotics. What do we know about the antipsychotics? Well, guys, remember, patient is experiencing psychosis. What does that mean? They're out of touch with reality. So the antipsychotics, the job of the antipsychotics are kind of to bring that patient more in touch with reality. So let's look at this first med haloperidol. That's our Haldol. Favorable side effect profile. Wonderful. But look at this, due to risk of neuroleptic malignant syndrome, keep the patient hydrated. You want to do vital signs and test for muscular rigidity. And if you see any of those labs out of order, you see muscular rigidity, you're going to notify the healthcare provider immediately before you give that next dose. You're going to hold that next dose and notify the healthcare provider immediately. Second generation antipsychotics, risperidol, we're going to watch for hypotension with reflex tachycardia. If you guys haven't watched my video, I did a pharmacology video on these medications. Very good video. Make sure you go back and watch it. It's going to make things so much clearer for you, because I don't have the time to reteach all of that. But anyway, risperidol, you're going to watch out for hypertension with reflex tachycardia. Increased risk of stroke in elderly patients. Zyprexa, useful in patients that are unresponsive to Haldol. We want to avoid IM combinations with lorazepam. And this medication, I'm not going to try to pronounce his name, but you see it. Look, use cautiously with QT prolongation. So those patients that have those cardiac dysrhythmias, we're going to be very careful with this medication. Look at what it says down here. During aggressive or violent incidents, Haldol has historically been the most widely used first generation antipsychotic. That has been our go-to for the antipsychotics. It is the nurse's role to assess for appropriateness of as needed medication. The nurse also educates the patient about the medication, the reasons being given, the potential side effects of the medication, even if the patient is out of control. You still have to do that teaching before you give the medication. Now, I want you to think about it. Why would that be even more important if we're giving something like an antipsychotic? Because they're out of touch with reality, which tells us there's a high risk that they may already be paranoid. Right? You want to give something to a patient, you don't even explain to them what you're giving to them, why you're giving it to them, what the expected outcome of that medication. They're going to think you're trying to kill them. And that's only going to increase their anxiety, their fear, their aggravation, their aggression. Selective serotonin reuptake inhibitors, the SSRIs. Don't forget, guys, the SSRIs, by the way, that is our #1 go-to class of antidepressants, okay? The SSRIs, lithium, anticonvulsants, benzos, second-generation antipsychotics, and beta blockers. They're all used successfully for specific populations when it comes to, anger and aggression. Let's take a look at this box. Long-term management. Drugs used for long-term management of chronic aggression. Again, we have our SSRIs, don't forget. Very important to know. That is our first go-to drug class when it comes to depression, but they're great for helping to stabilize moods. Okay. We're going to use cautiously in the patient that is bipolar. Lithium. We're going to make sure that we check the TSH levels before treatment. And something, I don't see it on here, but this is very important to know. I promise you'll see it on a test if you're taking pharmacology or you're taking a test about lithium. You better also be looking at those labs and paying special attention to the sodium. Remember, sodium is supposed to be 135 to 145. If the patient's sodium is too low, that can cause the patient to have lithium toxicity. And if the sodium's too high, higher than 145, that can cause them to have a subtherapeutic level of lithium. That is important to know. And the other thing that's important to know is the lithium ranges. You have to be looking at the patient's lithium levels because we don't want them to go into toxicity. Your normal lithium level is 0.6 to 1.2. Once that patient hits 1.5, they've hit toxicity. You have to know those lithium levels and you have to know the signs and symptoms of lithium toxicity. Don't say I didn't warn you. Let's keep going. We can also give anticonvulsants for long use. Gabapentin, gabapentin, let me go back to the anticonvulsants. Those are anti-seizure drugs. Gabapentin, benzos. For the benzos, potential for abuse, dependence, and withdrawal. So what does that tell us? If the healthcare prescriber is prescribing something for long-term management of chronic aggression, and we see in the patient's chart that they have a history of alcohol abuse, are we going to just blindly give this medication because the healthcare provider ordered it? No. We're going to withhold that medication and make a phone call and say, hey, I know you ordered this benzo, but do you know this patient has a history of alcohol abuse or heroin abuse or whatever it is? Because guess what? There's so many other things on the market. We do not want to give this to somebody who already has a history of abuse because there's potential for it. Make sure you know that. Second generation antipsychotics, beta blockers. With the beta blockers, look at this. Propranolol is contraindicated in asthma, COPD, and IDDM. That's your diabetes mellitus. Very important. I put a star. By the way, guys, if you're new to my channel, anything that I highlight or I underline is very important to know. There's a high chance you're going to get it on the test. But if I put a star next to it, that means there's a very, 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 very high chance you're not only going to see this on your nursing exam when you're in school, you will most likely see this at, an exit exam, such as your HESI or your ATI or even on NCLEX, okay? And a psychostimulants. So guys, this, like I said, this was going to be a short video. That is this portion for the de-escalation techniques and medical management. On the next portion, which should be the third and the last part of this segment, I'm going to go over important nursing interventions and teaching for the patient with aggression or anger issues. So please, in the comment section, let me know what you thought about this video. Let me know what you'd like to see more of. And don't forget, every Sunday, 1 p.m. Eastern Standard Time, I release a video where I go over nursing questions. I teach you how to answer the questions. I teach you how to eliminate wrong answer choices. Be sure to check that out. And don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. Thank you so much for watching this video, and you guys will catch me on the next video.